Sure, my name is Dr. Stephen Ye, and I'm a professor of ophthalmology, and I'm a specialist in retinal surgery from the University of Nebraska Medical Center in the USA.
All right, so why the surgery in Sierra Leone?
Yeah, well, first of all, it really is a pleasure to be with all of you here in Sierra Leone. I've been working here since 2015 at the tail end of the Ebola outbreak. And what we found was that individuals who had Ebola would develop eye problems that sometimes would need medicines and sometimes need surgery. And what we found by understanding this condition is that some of the Ebola survivors also needed retina surgery, which is advanced surgery that includes ophthalmology training, but also includes several years after that as well. And so we decided at that time that we need to set up a retina surgical setup to understand the eye complications related to Ebola and also treat the patients as well as other Sierra Leoneans. And so we've been doing this now in Sierra Leone in terms of treating patients and taking care of patients with Ebola or Ebola survivors for a number of years now. And now we've moved to develop this vitreoretinal surgical unit in concert with the Minister of Health, with the leadership of Dr. Jallikattu Mustafa and Dr. Lloyd Harrison Williams, the lead of the National Eye Program. So it's a really exciting time for all of us. Yeah, it's really important when we think about our ability to work, to be independent, to socialize. And this extends from childhood all the way to adulthood. And I think that that's the beauty of understanding of the retina, because the retina is where you derive your sight from. And so when the retina is injured and needs repair, now that we have a solution that we can actually fix the problem. So each patient, it varies. It can be as short as 30 to 45 minutes. Longer surgeries can be up to an hour and a half to 2 or even 3 hours. And really our goal is to train not only Dr. Lloyd Harrison Williams in the art and the medicine of vitreoretinal surgery, but also the staff and to develop the systems. And this has, again, been a really exciting time to work with the Ministry of Health, with the leadership of the Minister himself, Dr. Austin Demby, Dr. Jallikattu Mustafa, and everyone to really move this platform forward as we think about the importance of eye care and vision health for children, adults, and for all Sierra Leoneans, as well as other individuals in West Africa. Yeah, so these machines are really essential to modern vitreoretinal surgery because what it allows what's called minimally invasive surgery. It's really the best technology that we have available throughout the world. And what we need to take care of these very advanced and complex disease conditions. We think about not only the machines, but also the technical aspects of too. We have an amazing technical and biomedical engineering team that can also help to ensure that the equipment not only is maintained, but also is performing with a high performance fashion so that these surgeries can be executed in a good way for effective and safe surgery for Sierra Leone. Absolutely, we really think about the system, and so we've had the opportunity to work at Connaught Government Hospital to set up an eye unit with Dr. Jallikattu Mustafa, as well as Dr. Lloyd Harrison Williams and others, as well as an eye unit here at UMC. And so again, it's training the doctors, providing support to their already outstanding system, but also the ophthalmic nurses, the scrub technicians, everybody here who we work with, who we love working with, and they're great colleagues and friends as we've been here for nearly 9 years now. Well, you know, I'm speaking to the choir here, speaking to Sierra Leoneans who know what their capabilities of, and I've seen this, and then they know this to the strength of the confidence that they're developing and the abilities, and so we're here to really support and lift up their program. And as we sort of step back and watch them continue to advance and become independent and do things the Sierra Leonean way, I think that really there's always a striving for continued excellence as the program develops. Yeah, so certainly, violence is never acceptable under any circumstance, whether it's men and men and women, and certainly just thinking about the eye complications that can develop from blunt injury as well as penetrating trauma. I think that the two aspects that I would highlight is number one, with blunt injury, if there's not an eye injury inside the eye or to the surface of the eye, that can cause eye damage that requires retina surgery. And it's important for individuals who are working with equipment and hammering and things like that to always wear eye protection.
Yeah, safety
glasses to prevent that as well, whether they're welding, hammering, because these can lead to severe eye injuries as well. Fortunately, now we have the tools to help some of these conditions, but very great points. Again, violence is never acceptable, but it's always important, whether it's in domestic injuries or workplace injuries, that we have tools now that we can help to address the problem. Yeah, so I think that's a great point. So I think that there's eyesight that can lead to symptoms, where patients will come in to get their eyesight checked, and that always needs to be checked. And then there's also other conditions such as diabetes, high blood pressure that can also lead to vision changes even if you don't have symptoms. And so I would encourage individuals who have diabetes to have their eyes checked, but certainly if they have eye symptoms, eye pain, redness, or those types of symptoms, that they have their eyes checked. Yeah, so I think that really what we're thinking about is, as we look to the future, it's really important that we have these treatments that are available. And really it goes across the spectrum of childhood vision care and screening to also thinking about more advanced care, things like retina surgery, corneal surgery. We have a fantastic doctor from the States, Dr. Lloyd Williams from Duke University, who has been doing corneal transplants for Sierra Leoneans for some time now. And so whether it's cornea, whether it's retina, whether it's oculoplastic surgery, the range of surgeries we hope to continue to support that will be offered in Sierra Leone. So it's a really exciting time for the eye program in West Africa and in Sierra Leone specifically.
Okay, so you understand any message, thank you message maybe to the donor partners that are making government so far on that?
Yeah, so,
partners?
No, absolutely. No, I really thank the government of Sierra Leone. I thank the Ministry of Health. I thank all of the people here, both at UMC and also Connaught Government Hospital. I think the list, I'm sure I've forgotten somebody and I apologize. But then we also have a lot of partners from USAID who is funding our work, as well as the National Institutes of Health who is funding some of this investigational work to help Ebola survivors and understand why they develop eye problems. Yeah, the other aspect of eye care that we're working on is that we're working in partnership with Oloduri Children's Hospital with Dr. Nellie Bell, Professor Nellie Bell, to understand the different eye problems related to other conditions that are also very relevant to child health, including malaria, childhood infections. And sometimes we think about certainly what's happening from the standpoint of the child's systemic health, and that's very important. But sometimes there can be eye problems that can also develop. We know that in malaria, patients may develop retinal manifestations, retinal problems, and so we're trying to explore that and understand that further with Professor Bell and also her wonderful group of residents at Oloduri Children's Hospital. Hopefully understand the causes and also the changes that can occur in these very difficult childhood conditions as well. Yeah, so I think that there's different challenges with regards to both the medical and the surgical aspects. I would say that with the medical aspect really is related to the technical, being able to implement these instruments in very difficult settings. And also not only learning and teaching the equipment, but also the diseases are very complex and very challenging. I've been in practice actually now for about 13 years, and what I found is that the types of eye conditions and the retinal problems that we see in Sierra Leone can be very, very severe and require just really pushing the limits of our skill sets and pushing the limits of the instrumentation. Fortunately, we have the instruments and the skill sets, and we have a really fantastic Sierra Leonean team that partners with us that can be able to help take on these challenges. That's a really good question. So that back in 2015, we took care of a United States healthcare worker who was actually working in Kenema, in the eastern part, again, the eastern part of Sierra Leone, who developed Ebola, came to the United States, and we discovered that he had Ebola virus in his eye. Since then, that has not been discovered. But what we do know is that there can also be an immune reaction. The body can react to the prior history of a virus. And so we're trying to understand the immune system and why it continues to cause problems. And these are issues that affect not only the eye, but other aspects of Ebola survivor health. And so these are all things that we're thinking about or on our radar that really will go hand in hand with what we're trying to understand with this disease condition.